Migraine is a neurological disorder characterized by recurrent, intense headaches, often accompanied by other physical and sensory disturbances. Unlike typical headaches, migraines are a chronic condition that can significantly impact daily life, productivity, and overall well-being. This condition affects millions of people worldwide, with a higher prevalence among women than men, particularly during their reproductive years. Migraine is not merely a headache, it is a complex brain disorder that involves multiple biological and environmental factors. Causes and risk factors. The exact cause of migraine remains unclear, but it is widely understood as a result of abnormal brain activity that affects nerve signals, chemicals, and blood vessels in the brain. Genetic predisposition plays a significant role, as migraines tend to run in families. Certain genes may increase sensitivity to environmental triggers and alter pain processing pathways. Common triggers include hormonal changes, particularly fluctuations in estrogen levels in women, stress, lack of sleep, sensory stimuli like bright lights or strong smells, certain foods, dehydration, and weather changes. Some individuals also experience migraines triggered by physical exertion or emotional stress. Types of migraine. Migraines are broadly categorized into two main types, migraine with aura and migraine without aura. Migraine with aura, this type involves sensory disturbances, known as auras, which typically precede the headache. Auras can manifest as visual changes such as flashing lights, blind spots, zigzag lines, or temporary vision loss. Other auras may involve tingling sensations, speech difficulties, or muscle weakness. Migraine without aura, this is the more common form and involves headaches without preceding sensory symptoms. The headache phase can be severe and disabling, usually affecting one side of the head, though it can sometimes affect both sides. There are also less common variants, such as chronic migraine, which occurs for 15 or more days per month, and hemiplegic migraine, which includes temporary paralysis on one side of the body. Symptoms. Migraine symptoms typically progress through 4 stages: prodrome, aura, headache, and postdrome. Not all individuals experience every stage. Prodrome, this early stage occurs hours or days before the headache and may involve mood changes, food cravings, fatigue, neck stiffness, or increased urination. Aura, present in about 25% of migraine sufferers, auras involve visual, sensory, or motor disturbances. Headache, the headache phase is characterized by moderate to severe throbbing or pulsating pain, usually on one side of the head. It may last from 4 to 72 hours. Symptoms often include nausea, vomiting, sensitivity to light, photophobia, sound, phonophobia, and sometimes smell or touch. Physical activity often worsens the pain. Postdrome, after the headache subsides, individuals may experience fatigue, difficulty concentrating, or mood changes. Some describe this phase as a migraine hangover. Diagnosis. Diagnosing migraine is primarily clinical and based on patient history and symptom patterns. There is no specific laboratory test for migraine. Physicians use established criteria, such as those outlined by the International Headache Society, which consider the frequency, duration, and characteristics of headaches, as well as associated symptoms. Imaging tests like MRI or CT scans are sometimes employed to rule out other neurological conditions, especially if symptoms are unusual or severe. Treatment and management. Migraine management includes acute treatment for immediate relief and preventive strategies to reduce frequency and severity. Acute treatments, these include over-the-counter pain relievers like ibuprofen, aspirin, or acetaminophen. For more severe cases, prescription medications such as triptans and ergotamines are used to constrict blood vessels and reduce inflammation in the brain. Anti-nausea medications may be prescribed for vomiting and nausea associated with migraines. Preventive treatments. Preventive therapy is aimed at individuals with frequent or disabling migraines. Options include beta blockers, anticonvulsants, antidepressants, and recently, monoclonal antibodies targeting the calcitonin gene-related peptide, CGRP. Lifestyle modifications: regular sleep, stress management, hydration, dietary adjustments, and exercise play a critical role in prevention. Impact on life. Migraines can profoundly affect quality of life, interfering with work, social interactions, and daily activities. Chronic migraines may lead to anxiety, depression, and reduced productivity. Understanding and managing triggers, adhering to treatment plans, and seeking timely medical advice are essential for living with the condition. Conclusion. Migraine is a complex, multifactorial neurological disorder that extends beyond the common headache. With proper diagnosis, treatment, and lifestyle adjustments, individuals can manage symptoms and improve quality of life. Ongoing research continues to uncover the biological mechanisms underlying migraines, promising more effective treatments and preventive strategies in the future. Awareness and education are vital to reducing the burden of this debilitating condition worldwide.